I wanted to take a quick break from our regularly scheduled work here in the Senate and to highlight a few pieces of really good news that are coming out of Tennessee. We Tennesseans are so fortunate to play host to one of the country's finest research institutions, Vanderbilt University Medical Center, and it has been at the forefront of pandemic research into new therapies and vaccines that would deal with COVID. Dr. Mark Dennison, who heads up Vanderbilt's Dennison Lab, has been instrumental in identifying and testing potential treatment options for COVID-19 patients. Right now, Dennison and his team are working with the National Institutes of Health. You hear about that one a lot, the NIH, to test therapies that can fight the coronavirus and even improve outcomes for those that are infected. Other researchers at Vanderbilt's Vaccine Center are working with Dr. James Crow and scientists from the Department of Defense, DARPA, and several pharmaceutical companies to identify antibodies that are eventually going to lead us to a COVID-19 vaccine. The largest phase 3 trials for those potential vaccines are now taking place right here in Tennessee. Now, I'm sure many of you know that scientists at the Oak Ridge National Laboratory have been using Summit. By the way, that is the world's fastest supercomputer, and it has gone to work to help fight the pandemic. What they're doing is going down to the molecular level and studying how the COVID-19 virus behaves. This knowledge will help scientists all over the world build on their research and get even closer to finding a vaccine. But keep in mind that before we get to a vaccine, we have to make sure the American people have the information they need to stay safe and healthy as possible. As many of you already know, the coronavirus has disproportionately affected minority groups. In Tennessee, we're particularly seeing this with the Hispanic and Latino community. Methodist North Hospital in Memphis has taken that burden to heart and so far has passed out more than 400 COVID-19 care packets, and they contain masks, hand sanitizer, and educational materials on stopping the spread of the virus. This effort is led by Methodist North Program Director of Community Development, Dexter McKinney, and has been a terrific success. We thank Dexter for his work. Dexter's efforts in Memphis are supported by Linda Rosenblatt, who worked behind the scenes to make sure patients transferred in from nursing homes have access to technology that will allow them to speak to their friends and loved ones. And Rusty Parker, a supply chain expert who had to think outside the box and find non-traditional vendors for medical supplies, equipment, and services in the face of shortages. In Tennessee, we are ever so blessed with scientists, healthcare professionals, and volunteers who were working around the clock to do right by COVID patients and their families. Thank you for helping take care of one another.